Thank you everybody for joining us in today's webinar. This is the peer review in academic publishing process, pros and cons, and best practices. First off, the housekeeping. So this session is being recorded. The recording will be available on ISPO Learn for members who can access it directly through the platform, and for non-members, they will receive separate instructions on how to view it. Please kindly stay muted throughout the session to avoid background noise, and closed captions are also available. Please do enable them. You will see that option at the bottom of your screen. And then we also encourage you to post your questions in the chat box at any time during the session, but they will be addressed towards the end of the session. We'd also like to let you know that you will receive a certificate of attendance after you complete this webinar. You will receive a survey link early next week, along with the link to access the recording on ISPO Learn. And once you complete the survey, you will be able to access the certificate through your email. I would also like to take this opportunity to introduce our moderator for today's webinar, Arizo Ashraghi, joining us all the way from Toronto, Canada. She's part of the Prosthetics and Orthotics Services at the West Park Healthcare Center. Thank you, Arizo, for joining us. Over to you. Okay, looks like Arizo is having some issues. So if that's, sorry about that, if that's okay, Dr. Henk, Professor Henk, if you could start the webinar, that would be great. Thank you.
Okay. Thank you so much for the invitation. I'm now trying to share my screen. So if this is okay, I just can start, I suppose, for this webinar of the ISPO. I have been affiliated to Erasmus University Rotterdam, the Netherlands, so that's why I'm from Holland, as they say. And my main task at the moment related to reviewing is the Journal of Rehabilitation Medicine. So that is my main conflict of interest, that I'm editor of a competing journal. I must admit that I once published in Prosthetics and Orthotics a long time ago, but I'm not an expert in prosthetics and orthotics. So usually when I, welcome Arizo, usually when I talk about review process, then it's in a workshop where I can see the audience and see what is their interest and their motivation to participate in a interactive session. This is a little bit more difficult, so I will just go on, and I would like to ask you to ask your questions or comments at the end of my lecture. In fact, I have 3 separate lectures. I don't think I will do all 3 of them, but we will see, depending on the time left, what we are going to do. So this slide shows the most simple process or procedure of articles coming to a scientific journal. So the author submits an article, which is initially assessed by the editor, and the editor, in many cases, directly rejects, for several reasons, the submission. If the editor thinks that the article is okay, then the article will be sent to reviewers who independently will give comments on the paper and ask for revisions. So the reviews are seen by the editor. Revisions are required, then the author submits the revised article again, and then the same circle takes place until the time that the reviews are assessed, and the article is accepted or rejected, and then it comes into production and publication. So this is a simple procedure. Many journals have in this step, before sending it to the reviewers, they have section editors for specific topics. So there is an in-between step here. I have to say that in many, let's say, rehabilitation and technical journals, more the applied clinical journals, this whole procedure between submission and publication can take 4 to 6 months, which is actually way too long and sometimes very frustrating for authors, but also for the editors. So the initial rejection and the reasons for that is, there are some of them that can be mentioned here. One of them is that the paper is outside the journal's mission. So for ISPO, it's clear that your journal, Prosthetics and Orthotics, what the topics are, that the sort of papers that are being published. But in my case, in a broader rehabilitation journal, we receive all kinds of papers that are completely nonsense, like ophthalmology or traditional Chinese medicine or whatever. So they will be rejected immediately within 1 or 2 days. Another issue that sometimes a paper is considered elsewhere. So people send the paper to several journals at the same time, hoping that one of them will accept it. This is not acceptable, of course, but it happens now and then. The third reason is that the writing is difficult to understand. So when I receive an article and I cannot get through it because the language, the writing is so moderate or incomprehensible, then I sometimes reject. I must say that this doesn't happen a lot the last few years because many people use all kind of Grammarly and DeepL to improve their original article. And so this problem is resolving itself also by the use of AI. And finally, sometimes the authors do not follow the instructions for authors, and it has to be sent back to be revised before I can send it to the reviewers. There are also some technical reasons for rejection, like wrong analysis. I mean, the statistical analysis. There's no clear hypothesis or no clear research question. There's not enough evidence coming out of the project, of the study. Methodology is weak. The conclusions are inconclusive. And one of the issues that is often neglected is that there is a violation of research ethics. So I use this blog written by Jaime Fernandez Sobareras in 10 easy steps to review a scientific paper. This is very helpful to have a structure in my presentation. So these are the 10 steps, and I will go through them one by one. So if you, as a reviewer, receive a paper, you might want to follow these steps. And many journals, as I will show later, have their own checklist that helps the reviewer to have a structure in the comments that are going back to the authors later. So the first one is understand the purpose. So you can ask yourself why you have been asked to review, what is your expertise, that the editor wants to use for improving the paper, and which are the specific aspects of the publication that you should focus on. Always keeping in mind that you have to provide a fair and unbiased and constructive critique that helps the authors to improve their work. I come back to that later. So why do they ask me is the first step. Then the second step is that you go through the paper completely and thoroughly from the beginning to the end to see what is in it. And you go from the research question to the methodology, the data analysis results, and the conclusions. So then you have a first idea, first clue on which areas are probably fine and which other areas need further thinking and reading and comments in this case. So you look at the structure of the paper. Does it follow all the parts that are usually required for a scientific paper? Look at the organization and the clarity of writing, as I mentioned before. So you need to have a look at the abstract, which should be a concise summary of the study, and whether the introduction establishes the research context. And if there's a logical flow of thinking and of ideas between the introduction, which is the background of the study, the research question, the methodology, the results, and the conclusions. This should be in a logical flow. And we talked about the language previously. Then the research method should be appropriate for the research question. So you have to look at the study design, sample size, which in many journals like prosthetics and orthotics and rehabilitation medicine and this kind of clinical rehabilitation journals, sample size is usually low or too low, but that is a fact of life. How the data were collected, the statistical analysis, and whether the methods are adequately described, allowing for replication, which means that an article has to be written in a way that another researcher later can replicate the study and see if they find the same results. This is an important part of the progress of science, and it makes articles always more complex to read for clinicians than for researchers. Clinicians usually need less information to read an article because they do not want to replicate it. They want to understand it and use it in their daily practice. So then you examine the results and the analysis, and if the data are related to the research question, and if the statistical analysis is appropriate. This may, for many clinical reviewers, challenge, because nowadays statistical analysis are so complicated and so advanced that, let's say, a normal, between brackets, a normal clinician is not able to understand the statistical analysis anymore. So in many cases nowadays, we consult for the statistical and methodological part a separate expert, and then the reviewer of the clinical part of the study can leave this one, the statistical analysis, out of his or her comments. So it's a division of between the expert and the clinical expert. Then the interpretation of the results. In the discussion section, I always have difficulty in understanding why we use the word discussion, because the authors write something down and they don't get any feedback from the reader, so there's no discussion. So the interpretation is, in my opinion, a better word of this part of an article. So the authors need to provide a balanced analysis of the findings. And what is sometimes the case is that the conclusions do not align with the research question. So the conclusion in the discussion section should always come back to the research question and give an answer, concrete answer to the research question. So then there's ethical issues, there's guidelines and standards that authors receive or have available. There needs to be informed consent of the participants, of course. The confidentiality has to be guaranteed, and interventions should be or have a minimum risk of harm to the patient. So then there's the issue of references and citations. They should be accurate, relevant, and up to date. And that is really a difficult part for reviewers, because in many cases, after spending 2 or 3 hours on the paper, arriving at the references list of 50 or 60 references, how can you check in a short amount of time whether they are accurate and up to date? So this is a weak part of the review process, and maybe there should be another solution for this, because reviewers don't have the time to check all the references and see if they are correct or not. So this is an inherent weakness of the review procedure. Then how to give your comments. They should be constructive and respectful. So don't blame the authors, don't be negative. Do not only outline the weaknesses, but also the strengths, and give them specific and concrete comments and suggestions on how to improve the article. If possible, you can provide relevant literature, of course. So in any case, do not make personal attacks or using negative language to the authors. They have spent a lot of weekends and holidays on writing the article, and it's not your task to, let's say, undermine their confidence and their enthusiasm for the topic. And let's say number 10, conclude with a summary, strengths and weaknesses, overall recommendation for the editor on accepting the paper as it is, further revisions or rejection. In many cases, this recommendation doesn't go to the author in this phase, but to the editor, who uses this for his final decision. So these are the 10 steps with some additional remarks from my side. I will now go through a list that is a reviewer form that we use in the Journal of Rehabilitation Medicine, just to recapitulate what I've said earlier. So we start with the overall recommendation to accept or not, or asking revisions or require revisions or reject directly. Then we'll have a 1, 2, 3 qualification for the design and quality of the data. If the discussion and conclusion are adequate, the methodology, and the importance of the study with respect to new information. A lot of studies are not, I would not say the word irrelevant, but they do not offer a lot of new information to the existing literature. And this is really sometimes really sorry for the authors. But when there are like 5 previous and better and bigger articles on the topic, and they submit a retrospective non-controlled study, then it doesn't really give new information to the scientific world. And then the study probably will be rejected. This same goes for confirmation. So a study may be not completely new, but when it confirms in a valuable way what has been written by other authors, then it can be accepted for, in principle, be accepted for publication. Then I come to the title, and I have to admit that let's say 80% of the titles that we receive are not adequate. They are too long. They are, it's difficult to understand what the paper really is about. And most of all, it's not attractive. And so when you, after dinner at night, check your PubMed or other search machine, looking for specific topics, you look at first at the titles. And if the title is not attractive, you will skip that article. You will never come to the abstract or the rest of the article. So many authors do not spend enough time on the title, and this is really sorry for them, but also for the journal. So this is an example of a title: Multiple Sclerosis Spasticity, the role of anesthetic nerve blocks on rectus femoris muscle when stiff knee should be treated with botulinum toxin. So I would say for this title, reduce it to 50% or 60%, and the title should be just one sentence, maybe stop over here. And the short title could be Multiple Sclerosis Stiff Knee Integration of Anesthetic Nerve Blocks and Botulinum Toxin. So this is just an example. This is an example of a straightforward title: Effect of mirror therapy in post-traumatic complex regional pain syndrome, a randomized controlled study. So you know what to expect and whether you want to continue reading this article or not. These are all examples from a Journal of Rehabilitation Medicine. This one, when I first saw it, I thought, what the heck is this about? The veracity, function, integrity, and comprehensiveness of evidence. So I had to ask the author to come up with another title because nobody would understand this one. So this is the last one is an example of a very long one. And here the short title is Post-Acute Impact on Participation in Daily Life Occupations After COVID-19. Nowadays, personally, I use AI when I have a title that I want to condense, to shorten. I ask AI for 5 alternative titles. And it is amazing how well this works. And then I propose that alternative title to the authors, of course, because otherwise they do not recognize their own article when it's published. So then the abstract is that a fair summary of the paper. The abstract, like the title, is the second important part of a publication. And authors usually write the abstract after they have done all the other writing, but I would propose to spend more time on the abstract. In many cases, it's too long, it's not concrete, and for readers, it is the second step in deciding to read the article, and for authors, it is the second step in the decision whether or not to use this article as a reference in their own work. And citations are important for articles, isn't it? Then the keywords, the aim of the study, the statistical analysis, as I discussed before, ethical issues, the registration in public registers, so that you can see this is not a fake study, but it has really been registered before it is executed. Results, the length. At some point, I thought when we publish articles online and we don't use any paper anymore, the length is not important because it doesn't cost any trees or forests. Nowadays, I think we don't have the time to read articles that are too long. So whatever authors can skip or reduce or shorten, they should consider to do that. So shorter and clearer manuscripts are really wanted. And figures and tables. When I see many articles and I see the tables, then I really get a headache because they are full of numbers and details and rows, and as long as a table can be replaced by a figure, by graphical representation, that is preferable. Because in a figure you can see what happens between time point A and time point 1 in a certain outcome. Within 1 second you can see the differences and what happens. And tables, you have to go to all these details and numbers before you see what the result of the study are. So I prefer figures and I hate tables. And also an issue is that some authors, they repeat what is in the tables in the text, and that is redundant. And it is making the article less readable and longer. So the information in the table is in the table, you don't have to repeat that in the text. Limitations of the study, that is an important part, and many authors have difficulty in seeing the limitations of their own study. It's like seeing the bad behavior of your own children. For the parents, it's difficult to criticize their own children because they don't see what other people do see. So authors have like a psychological threshold for limitations. Another thing is that I prefer to have not only limitations, but also strength. Give authors the opportunity to also discuss the strengths of their study. Reference, we discussed that. Grammar and style, as I said, not a big issue anymore. Now we have all these kind of programs to improve the grammar and the style. I'm really in favor of using them because it saves a lot of time. It makes the article better. And if the article is in a better language and grammar and style, it has a bigger chance of being accepted. So then when I arrive at the comments to the author, I've seen this before, I'm going to summarize now. So a good review in summary is it's clear, it's a good response is only possible when the authors understand it. So not only the authors have to write an understandable article, but also the reviewers have to write a review that is helpful for the authors. It must be constructive and identify the specific problems. And it should be consistent. So the recommendations should directly follow from the comments. So if you have a comment, please help the authors by a recommendation to improve that part of the article. And this is a slide from Stokic, the chief editor of the Journal of Rehabilitation Research. Faith is that we need to have a fair critique as a reviewer. We need to have appropriate expertise, which also means that when you get an invitation to do a review and you do not feel like an expert on the topic, then you may decide to reject the invitation because you have not the expertise for this specific study. You have to be independent in giving your opinion, so you don't, if you have worked together with the authors or in the same department or have been in the same consortium of study, then it's better to deny the invitation. If you report and give a review, do it in time, like 2 or 3 weeks. And your comments should be helpful. So this is a short way of summarizing how an effective peer review looks like. So this is the first part of my webinar. And there now is time for some questions. I give the word to Arezzo.
Hello, everyone. Thank you, Dr. Hank. It was a perfect presentation. We have one question from the floor, and but do you want to continue after the questions?
It's all up to you. I have 2 more, maybe shorter lectures, and
Wow, thank you.
so I can go on forever. One is on why you should never refuse an invitation for a review. And the second one is the disadvantages of the review procedure, why it is not a perfect way of improving scientific articles. It's more a critical reflection on the whole business of reviewing. So it's up to you.
Both sounds very interesting to me, and I'm sure to the audience. So let's go to the question. I guess you tapped on it briefly. It's about how about using AI in researching, as let's say in writing, in finding citations, or to rewrite a part of a paper, meaning rephrasing it.
Well, it is a good question, and I also expected this one as one of the questions. So I had some time to reflect on it, and many editors are a little bit afraid of AI, that it will undermine the process of publishing. And I do agree there are some risks that people write fake articles. I just had a discussion with one of our section editors, and he had an article that seemed to be written by AI, where they used an older article and changed a little bit the title and said rewrite this article. So there was a lot of similarities between the old article that has been published 2 years ago and the new one that came in. So there is a risk of predatory articles, like we have predatory journals. There are thousands of journals that just are there to make money, and they are not peer-reviewed, and they just ask people for money, and then they write an article for them. So there's a lot of criminal activities in the world of writing and publishing. But on the other side, I'm from the Netherlands. My mother language is Dutch. So all my life, I have been struggling with writing articles, writing grants, doing presentations. I always had to do it like this, as a disabled person. I didn't have the same rights and opportunities as people in Canada, United States, and England. And now having Grammarly and DeepL and ChatGPT, finally, after decades, I feel on the same level of all these people that were privileged all these years. So part of the success of the United States and Oxford and Cambridge in science, of course, they are all brilliant. I have to admit that, but part of it is that they do everything in their own language. And we in Europe or in Asia or in South America, we are always disabled researchers. and authors. So now to come back to the question, I showed the example of improving the title. You can also rephrase or improve the abstract. And then you can accept or not what AI suggests. So for writing an article, I'm not against AI when it is used in an appropriate way, in a fair way. And then when you acknowledge at the end of your article the support of a therapist or a secretary or someone else, why not acknowledge the support from Grammarly or DeepL or AI in writing the article? And writing the article until now, and it still is a lot of work. But the main work and the real intellectual exercise is done when you started a project and have to write it down and execute it. That is the real work of research. And at the end, the article is just the end result. And AI will never take over a project and include patients and test them and treat them and do interventions. That still is human work. So I have an open mind for AI, as long as it used in a positive way, and if you acknowledge it in your paper. And many journals nowadays have instructions for that.
So are you you're implying that could we say that like the journals are gonna start asking the authors to actually declare if they have used AI in any part of the writing or editing of their papers? Do you see that coming?
It is already there.
They use.
It is already there. And I think it should be there, not also that AI has been used, but also where it has been used. What specific parts, if you say we used AI to improve the title, that's okay. But as an editor, I want to know what, when, and what they used it for. And then it's open. Then what the readers can see it, and then it's transparent. So if journals do not have it yet, they should have it tomorrow.
Yeah. Okay, so because we have like maybe 10 more minutes, 10 to 15 more minutes, would you like to go through the first suggestion that you had? It sounds interesting to me, like why you never should actually say no to reviewing an article.
Okay. This is the one?
Yes, yes.
Okay. So the main reason is reciprocation. That is, that you do not do to others what you do not want them to do to you. So for every paper you published in the past, 2 or 3 reviewers have spent time to read it and improve it. So if you are only willing to publish but not to review, then you're like a parasite of the system. So if you want to publish, you also have to do in return reviews. There's no question about it for me. So each year, do a review for every submitted paper as a second or first or last author in that same year. So if you have like published 2 articles in 2025, you should do also 2 reviews. Then the system keeps in balance. Otherwise, people profit from it, but don't give their own input to the system, and they don't help other people. So when you do want to be an author, you also need to accept to be a reviewer. This is, for me, no discussion about it. Then there is the issue of solidarity. people that submit their work to a journal depend on the willingness of the reviewers. So other authors cannot do with you as a reviewer. So people really need you, otherwise the system collapses. It's not only the reviewers, but also the editors. Finding reviewers, in my experience, but I know from other journals as well, is becoming more complex and more time-consuming every year. And I know of articles that have gone to 10 reviewers asking them, and they all say no for several reasons, but the most common reason is that they say, I don't have time to do it. And that is, of course, an excuse that can be valid. But if you have time to publish yourself, you also should find some time to help others by giving a review. And the problem of this situation is that papers are between publication and submission, when it takes 6 months, that is way too long. So sometimes finding good reviewers takes 2 or 3 months, and that is unacceptable. Then you could think of it's like an ecosystem of editors, authors, reviewers, and they build a successful system of publishing. And when the reviewers are the weak link in this procedure, then the whole process is at risk. So the authors have to wait too long, the editors have to spend too much time in finding reviewers, and the whole system weakens over time. What also can be an incentive for reviewers is you have the opportunity to read in an article and to get inspired from this article for your own clinical work or for your scientific work. So why not using this opportunity to improve your clinical work and your scientific work? Related to this is that when you are a reviewer, you read articles that nobody else has seen so far. So you are ahead in terms of information of other people. So you read the results of most recent research that nobody has ever been able to see. So you have a head start in your daily work, and which can be for some people really handy. We discussed statistics in the previous lecture, and it may be interesting to learn from, as a reviewer, from the new designs of studies and statistical analysis. So you can learn more about these new approaches and use them in your own work, if you're a researcher, of course. So you stay up to date with what is happening in the scientific world. This is more a selfish or egoistic argument to do reviews, is to improve your curriculum vitae, your I can't find a word. If you can put a list of reviews for high impact journals in your curriculum vitae, it can help you with when you want to find a new job, when you apply for a grant. So doing a review shows that you're acknowledged as an expert in a specific area, and that is helpful in certain situations. And a good reputation is always of a great value, and many people underestimate it, but it is really helpful when you want to make a career in research or in clinical science. You can get rewarded by Publons, where you can track your publications, your citation metrics, and reviews in one place. So it's like a depository for these aspects of your scientific work, and you can use that when you apply for a job or whatever reason. So these are all reasons. I did write an editorial on this topic, and my co-editor said you have to leave this one out because it is maybe not very reasonable or kind, or it may result in some questions, but I put it nevertheless in this lecture. You might want to accept a review to support your relation with the editor. Sorry for the mistake here. Suppose that an editor has asked you several times and did not get a reply or a negative reply. What will happen when you submit an article to this journal yourself? So the editor depends on you as a reviewer, but you as an author also depends on the editor. And a bad reputation as a reviewer may harm your reputation as an author. I know this is a form of blackmail, and it's maybe not ethical, but you know, things happen, and I think it's worthwhile to keep this in mind when you keep saying, I have no time, I have no interest, but you keep sending articles yourself to journals. So this is, in a rather fast way, the reasons for never refuse an article for review. Is that quick enough for you?
Amazing. Thank you so much. I myself learned a lot, even though I've been reviewing for a couple of years now. But thank you so much for your time. And we have one more question from the audience, and then I have just myself have some comments and questions. So they're asking for new practitioners who have no idea about research. I assume if you are an orthotist or prosthetist and you haven't done research in your life, how you can start learning to collect data and to evolve to become a researcher. I have an answer for that, but I want to first hear from you and then I will take over.
Well, this is a question that is not really related to the topic, but anyway, it's a very interesting question and important. Before I give an answer, I would say doing research is not a hobby. It is a profession. And some people combine two professions, clinician and researcher, but it has its own rules, its own learning curve, its own, you need some talent, maybe for some research. It's not just a hobby on the side. So it's a serious business, at least when you want to do research that counts, that improves the world, that is helpful for patients, and also just to write an article, because everybody can write an article, but it should be relevant and of importance. So if you have that ambition and you have maybe some talent for doing research and maybe some passion, and you're all alone and you don't have any idea on how to do it, then the only way is when you have a good research question, a good project in your head, or you have a certain group of patients that you want to write about, or you have a certain intervention that you want to apply. I think the only way is not to go into books or into the internet or to an AI, but find a person that is willing to help you, because that is the most effective way. And it look for a mentor, a buddy, someone that you can rely on with a good track record on the topic, or on a comparable topic. And so find someone to help you and support you and make the first steps. And then later you can go to congresses and workshops on statistics and read books. But I think that the personal approach is the best.
Thank you so much. Yeah, that was perfect. And because you used the word mentor, I was actually going to say that this webinar was brought to the audience by the scientific committee. And at the scientific committee, if they have received emails, you guys know that we have mentorship program. So if there is anyone who is extending hand to help to others who are early researchers or to those who want to actually get help. So you can fill in the forms online, and Kritika, I'm not sure if we can put a link there. You can just submit your interest there, and we will actually, ISPO will help matching you to the right person who is gonna help you. I just myself, if there is no other question, I just wanna give some. Oh, okay. So another question from the audience. So can we use AI to refine the abstract? I guess you already answered that, and I think it's a yes. But if you have anything to add, please go ahead.
Yes, I think if it improves the abstract, then you should use it. So it doesn't change anything on the project or on the results. So anything you can do to improve the abstract, fine, just do it and enjoy it because it's amazing. Is that an answer to the question?
Yeah, that was pretty clear, and I hope the person who asked the question got the answer. So I myself wanted to say that as a reviewer, I guess there are some other points that came to my mind while you were actually presenting, so that we should check if the references are outdated. Like if there is one or two reference or citation that are old, because like there is a certain fact that it goes back to the definition of that concept, it should be fine. But if you find 10 out of 15 citations are outdated, then you should go back to the editor and say, even before, I guess, reviewing maybe, because there are times that you can communicate with the editor efficiently and go through some steps before you going to the authors and then back and forth. And then the statistical analysis, my own experience is that if you don't know certain statistical tests or you haven't gone through them, then ask the editor to provide someone who is gonna help with the statistical analysis review, and you say that like I'm gonna just review the rest of the article.
Right.
And then timelines of some journals are so short that I assume some reviewers find it difficult. Like some journals like PLOS ONE, they only give you 10 days, right? So it's okay. I guess we can go back to the editor and say that I need more time. Usually they also offer that. I guess as an editor, you also have had that experience. And from your experience, have you had, do you think paid journals versus non-paid journals, is the review process is different? Is it just a timeline that is different, or do you see bias because now I'm paying $2,000 for my paper to be published? Should others be worried that how the review process is going? Is it less strict? Is it the same level?
To start with the last question, the difference between open access paid journals and the old-fashioned ones that were paid actually by the subscribers. We changed from the old system to the open access with publication fees like 5 years ago, and I didn't see any change in our policies. Because, well, it depends. The Journal of Reputation Medicine is a non-profit journal, so we don't have stockholders in Elsevier or Springer or whatever the big publishing house where people have to make money. So I never reflected on that. You could say open access journals with a publication fee publish easier because they want the money. I think when they have to decide on having lower citation impact factor because of the bad articles, that they just accepted that for the money, they shoot in their own foot. But I'd never thought about this issue. So for us, it doesn't. I only think that journals should be open access all the way, and that authors, when you are doing a research project with a real grant, with funding, nowadays the publication costs are integrated in the grant. But for some countries, a fee of $2,000 is a lot of money. And then most journals have a specific rules for low income and middle income countries to have a waiver on the publication fee. So there are solutions for people that cannot afford it. And you know, when you're a PhD student and you work for 4 years on a project, and you have a salary and you have a computer and an office and your supervisors, the whole project will cost $300,000. So the publication fee is like a few percent of the whole process. So, but if I go back to your first comment, which is really interesting, the references, you're completely right that when you just check the dates or the years of the publications, and you don't find anything younger than 5 or 6 years, then probably this article has had a long journey after the first version through all kind of other journals. So that there's a risk. Another thing that I saw, there's a lot of articles on spasticity and stroke, and everybody starting the article on spasticity uses the reference to Lanz, the definition of spasticity. And it has been cited thousands of times. And I wanted to see the original article of Lanz, and it took me 2 days to find it, because it was an abstract book of a conference. It is not even an article. So it's a one-page summary of a presentation that he gave in 1960 somewhere in a neurological congress, and it's been cited thousands of times. And when you read it carefully, it's not a good definition. So
exactly, yeah. So many
so
other
it
examples.
illustrates
Thanks for
that
being
references are a weak part of our publications.
So the time hits an hour. Thank you so much for the audience for being here, for your questions. If you have any other question after this webinar, you can always email us. Kritika, if you have anything to add, otherwise we will wrap it up for today. And looking forward to see you all in the future webinars. Thank you, Prof. Henk. Thank you. Really.
Thank you,
Thank you
everybody.
for the help. Thank you for being there.
Thank you.
Bye-bye.